on part 3. We're here with Dr. Nicole talking about breast cancer. She's an oncologist, hematologist. You can watch the other episodes where we talk about who Nicole is, how her cross-cultural background, what is it, and how she enjoyed crossing borders, and also about breast cancer and when you get that diagnosis, treatment, and now post-treatment. And then we're going to go to loss and translation recipes, no, because Nicole is not a cook.
Yeah, I will fall short on the recipe thing.
Yeah, maybe you can recommend a book, a movie that you like, like the fun part, right? That connects you with us. Okay, so now we're talking about in this third part, after treatment. After treatment, I know through my own experience that the treatments can go for a year, right?
Sometimes, yeah.
Especially with immunotherapy, that maybe you can. We'll talk a little bit about what are the treatments for cancer towards the end of this interview. Now we went through it, and suddenly it's your life. You were in survival mode for all this time, and suddenly it's gone. And from getting blood tests every week, for being in treatment every week, suddenly you're like left alone, kind of in the universe, thrown out to the normal world, and you feel drained, and it's like post-traumatic. Because suddenly it's like you don't realize what you went through. I don't know if it happened with your mom or some of your patients, but with me, it happened. Like a year later, it's suddenly I remember everything. I get the anxiety. I'm fearful of recurrence, What is the transition? What is the do's, the don'ts? What support? What answers can you give us?
Well, there's really not a satisfying answer, to be honest. The hard thing about estrogen-sensitive breast cancer is that it actually can relapse 20, 25, 30 years later. My longest relapse for just estrogen-sensitive, HER2-negative was I had a patient who relapsed at the age of 90 in her bone, and she had it when she was 60. So for estrogen-sensitive breast cancers, the answer to am I cured is if 30 years you die from something else, you were cured of your breast cancer. It's like why one of those cells can lay dormant in bone and then just wake up one day, I don't think we truly understand yet. So that's a hard answer. And CAT scans randomly, they aren't helpful. They don't find it any faster than a symptom does. So I tell my patients, be vigilant about symptoms. Like if you've got a back pain that is not normal for you, call me. I'm going to do the appropriate imaging study, or a headache that's not going away. But then I try to also tell them, if you feel fine, you are fine. So that's the mantra. If you're feeling good, like don't let this cancer define you. Now, for the more aggressive ones, like triple negatives, if they don't come back in 5 years, you're cured. While they're a little worse in their prognosis, if you are at 5 years and they don't come back, I'll tell them you're cured. You don't even need to see me anymore. So that's why there's such different disease, and that answer differs based on what you have.
Yeah. And in the other ones, what are the probability of recurrence in general in the 4 of them, once you're supposedly cured?
Well, it's a really long answer. Like how I quote those numbers to patients depend on the receptors, but it also depends on stage. So stage is how big is it in the breast? How many lymph nodes were positive in the armpit axilla area? So combination of receptor status and lymph node and size, like the anatomic stage, is kind of what helps us generate that number for a patient. But I can't give you one number because of, it's like you've got 4 different receptor patterns, and then you've got node negative and node positive in each, and how many nodes and how big was the cancer. So it's like there's not one answer to that question. It's individual.
And what about treatments? How have the treatments evolved in the years? And how do you foresee the future for cure for cancer, or any kind of cancer, or specific ones? Is it possible? I've heard, is it going to be one day a vaccine that kind of, is that possible?
Well, there is HPV. Like the human papillomavirus vaccine. Yeah. That's a vaccine for cancer. So it already exists. Another one, vaccination for hepatitis B. Hepatitis B virus is another oncovirus that causes liver cancer. So it already exists in certain situations. I think like broader categories for cancer in general. So we haven't gotten a new chemotherapy drug. I would say it's been maybe 10 years since we got a new chemo drug. They're just not being developed like chemotherapy as you think of it traditionally. Where the field is going is immunotherapy. So basically drugs like you see them advertised, Keytruda, Opdivo, those are the trade names. They basically take the brakes off the immune system so that they can attack the cancer. And we are seeing people surviving things that they had no business surviving. So like stage 4 lung cancers, especially, I have patients alive with stage 4 lung cancer at 5 years with no evidence of disease on their scan. And like in a lot of diseases, you'd call that cure. I think we're all afraid to say it, but it's like the immune system attacks the cancer, and then you've taught those T cells to surveil for recurrence. It's even some like melanoma is another very immune system sensitive, kidney cancer. Like we didn't have any treatments for kidney cancer until immunotherapy started. And then there's targeted therapies. So an example of targeted therapies in breast cancer would be a medicine called Herceptin, which is an antibody that's been engineered to the HER2. I mean, that changed the game. That Herceptin was FDA approved for stage 4 disease in the, I think, like early 2000s. I mean, before that, women were dying of that disease. And now their prognosis is as good as if they're HER2 negative. And it specifically targets that receptor on the breast cancer cell and kind of recruits the immune system to kill it. But there's other targets now, like we're sending gene profiles on the tumors. So it's not genes you're born with, it's genes in the tumor. Like we have drugs to target those things. We have things called like BRAF MEK inhibitors, NTRK inhibitors, FGFR2, like all these weird names. We have drugs to target these things. So these are the drugs that are being developed. There's another thing called CAR T, which are engineered T cells to kill the cancer, bispecific antibodies, which grab a T cell and grab the cancer and bring them together so that the T cell can kill the cancer. There's different ways of blocking estrogen. They're finding new drugs to block estrogen. So, is there a cure for cancer? Like all of them? There's not one universal cure for cancer because they are all such distinct entities. And there's not going to be one universal vaccine. It'd be like, it's the difference between a cow and a horse. It's like they're different animals. So, these discoveries have come by, 2 steps forward, 1 step back. But we have absolutely made progress in the past 50 years, and I anticipate that will continue, and hopefully the NIH doesn't close, so we can continue to do good cancer research.
Thank you, Dr. Nicole. I think that in these 3 series, we have gone through a lot of stuff about, the reality of cancer and how to prevent as much as you can, and what are the different kinds of breast cancer, what kind of things to avoid, like how to do what you can control it in your life, like eat the most locally, avoid the pesticides that you can avoid, right? I always say that. And do your mammograms. It's like mammograms saved my life, I have to tell you, because it was a checkup. So it's very scary to think that if I hadn't done it, I probably wouldn't be here today talking to you. Just the scary part, because it realizes that, we all know we're going to die, we all know we're human, but you don't know how frail we are as human beings until something happens in your life, right? And if you can avoid something by doing a checkup of a mammogram, just do it, right?
Yeah. Well, I always say, like, a mammogram shouldn't make you feel scared. It should make you feel powerful. Like you did the thing that cured you. And I told my mom that too. I'm like, congratulations, you saved your own life. Good job. You did what you were supposed to. Yeah. And you do have control over that.
And so I recommend everybody to listen to all the other podcasts of this series, 1, 2, and 3. And Dr. Nicole, is there anything else before we go to Lost in Translation that we want to hear all about that? Anything else that you want to add to all of this that you have talked about?
I think something I've been struggling with in my career is less and less confidence in institutions. And I think a lot of that got eroded around the time of COVID. I meet a lot of patients who come at me like, you're just here to make money off of me, or they're hiding the cure for cancer because they just want to make money off of it. It's really not the case. Like every doctor I know and every doctor I work with went into it for the right reasons. And the state of medicine now is most doctors are salaried employees of hospitals, and we don't make more or less money whether we treat you or not. So there's really like nothing underhanded going on here. And most of the time, your doctor has your best interest in mind, and they have no financial motivation to make anything but the right recommendation, because that's just a place where I'm seeing society going as a whole. But like in reality, I am a salaried employee of a hospital, and my only motivation is to do the right thing for a person.
So they don't pay you more, let's say, to make it clear, okay, I'll say it. They don't pay you more because you ask for so many tests or you put people to all these treatments, right?
No. In fact, like My bonus structure has nothing to do with my infusion volumes. So like I don't get more money if I give more chemo. I don't get more money if I order more tests. In fact, like sometimes I think I over order because I'm paranoid. And I kind of like, everyone's like, can you calm down? Like, how many tests are you going to order? But it's more because I don't want to miss something. That's more my motivation is a little bit of paranoia. But yeah, like there's nothing shady going on here. And I think a lot of people think there is, they think we're hiding the cure for cancer. And my retort to that is, if you've ever been to the American Society of Clinical Oncology National Meeting, that is a group of people who really want to be famous, and they want to be famous because they found the cure for cancer. And if there was a cure, those people would make it known because they would want to be famous and known for curing cancer and win the Nobel Prize in medicine. So it would never stay hidden.
We human beings are so weird, but I have to tell you, being through the doctors and the hospitals and the treatments, most of the people are there because they're passionate about their profession. It's a really tough profession. You have to study a lot. They make you work very hard, the corporations, the providers, and you do it because you really have a call. And I want to congratulate you and all the others in your team and all the other peoples that do it because they really feel that it's their purpose in life. So thank you so much for doing this, and just trust your doctor. And if you don't, find somebody you trust. But an integrative medicine, it's okay, but just do whatever you have to do. It's like if you have a broken leg, you're not going to go to a holistic doctor, right? You're going to the ER, right? So this is like an emergency. Just do it.
Yeah, or do both. It doesn't have to be one or the other. Do both.
Do both, yeah. I will never forget the guy stopped me. Nobody got cured with a tea. There's not a plant that will cure you. I still remember before my husband, he was prepping my husband into surgery. We'll never forget that. He worked 20 years in slow caring. Can you imagine? That was sent to the universe for me.
That was cosmic for sure.
Yeah. And now it's time for fun, Lost in Translation, confessions, and burger movie, because we're not going to have a recipe, right? And you're not a cook. So Lost in Translation, do you have a story you want to share with us?
So you shared my story in your first episode about calentitas versus colores. That was my screw up.
Okay, you have to explain that in first person.
But I have another story. It was a lost in translation to me. So like I am good without an interpreter. If I have an English speaking family member in the room and a Spanish speaking patient, if I don't understand something, then the family member can help me so we can just speak in Spanish, right? So I was trying to tell, it was a grandfather and his grandson, and I was trying to tell, the grandfather was my patient. I was trying to tell him he was iron deficient, and I needed him to take iron, and it's best absorbed on an empty stomach with something acidic like orange juice. And he looks at me and he goes, "Jugo de China?" And I looked at his grandson. I'm like, did you could just call orange juice China juice? The grandson was like, yeah. He's like, I have no idea why he calls it that. And it was like in that moment, I just said to myself, like, how am I ever going to learn this language? Like, how did we get there? And so apparently, I guess in Puerto Rico, there's a fruit that's a lot like an orange that they call China. But like, I only found that out when I talked to my MA who was from Puerto Rico, and she educated me. So like, that's, I think, the thing I struggle with is from country to country to really truly communicate, you have to understand like cultural backgrounds and just what is it like to grow up in those places. So it is definitely a minefield for miscommunications and misunderstandings. But I just remember how I feel in that moment. I'm like, are you serious? Like, why in God's name would you call it China?
Yeah. You know what? It's really funny you say that, because in Spain, we have an expression that if you don't believe something somebody tells you, you tell them naranjas de la China. Like, yes, now you're telling me like the oranges came from China, right? And I think I looked at it and it was like, yeah, originally the origins came from China. So that's why naranjas de la China. But you have to share the story of La Calentita, because you have, in this podcast, it's first person, it's your story.
Yeah. Okay. So I block a lot of estrogen and cause a lot of hot flashes. So I was trying to ask my patient who was from Puerto Rico, I was saying night sweats, sudores en la noche, but that's not, like, night sweats are a little different than hot flashes. So I was trying to explain it, and she looks at me, she goes, "Oh, calentitas." So I'm like, sure, I guess that's the word. So I'm like, yeah, do you have that? And then for the subsequent 3 months, I used that word for hot flashes in every visit. And I started to notice, like, when you've said something weird, they give you the look, like the what?
But Latins are very polite. They won't tell you anything, right?
So I was at your house, and your friend is an interpreter, and she does, I think, like law and medical. So I asked her, I was like, I need you to clarify a word for me because I'm getting weird looks. I was like, what does calentitas mean? I said, if I ask someone if they have calentitas, what does that mean? And she's like, oh, you're asking them if they're horny. And I was just like, my God, what have I done?
So from now on, please ask us first.
Calores. The word is calores.
Calores,
so
right?
I learned after maybe offending some of my patients.
I'm sure that they appreciated your effort in trying to speak Spanish. So that's lost in translation and confession. That's a confession too. But
Confession.
Any confessions you have that you never told your mom growing up, something you messed up? Because you look like the proper girl, the nerd, that one that never got into trouble, right? That did the right thing always in your life. Come on.
Yeah. I mean,
imperfection?
In my 20s, I had, some poor decisions under the influence of alcohol, but never behind the wheel of a car. So I had fun at Penn State. Let's just leave it at that. But I was an adult then.
Yeah, let's leave it at that.
Quote, adult.
What happens in Penn State stays in Penn State.
Yeah, pretty much. Well, most of it I can't remember, and there wasn't Facebook, thank God.
Whatever, Facebook is the problem always, or it has been. Yeah. And do you have any book or movie that you want to recommend to our listeners today?
Well, I'll recommend the book you gave me by Isabel Allende, The Wind Knows My Name. It's a story of 3 different immigrants that is wound together in a very emotional way. I love that book. And actually, one of my favorite movies is a movie called Lady in the Water. It's M. Night Shyamalan, and it's about this like mystical being, and like when humans were more connected to the earth, they were in communication with these mystical beings. And then when we became horrible and started killing each other, they just kind of went away. And it's this story of this guy like discovering this mystical being and how he goes about doing it. It's like one of my absolute favorite movies ever.
I'll have to watch it. We're ready down.
Yeah, I cry, I sob every time I watch that movie.
And you watch it? You're still watching it?
Oh yeah, I'll still watch it. I've probably seen it like 50 times. I love it.
Oh my gosh, I'll have to watch it then. Okay, thank you so very much, guys. If you have any questions, if you want to put anything in the comments, we'll refer them to Dr. Nicole. And if you want to have, make any comments, if you want to just follow us, please, because the algorithms love it. So and share this information because it's a very important information. Dr. Nicole is very busy, but she gave the day and the time today for all of us. So thank you very much. I really appreciate it. And I hope that everybody went with a handful of information that will serve them and will serve others. Thank you very much. Don't forget, Crossing Cultures with Christina Luna, and today our guest, Dr. Nicole. Every week, we're here for you.
Thanks for having me.